Good day, everyone. Welcome back to this session. We will continue our discussion on cardiovascular telehealth clinical care. Let's review what we studied in our last session. In that session, we talked about breathlessness. We learned that breathlessness is a key warning sign of serious heart problems. It may appear subtle in reducing activity, difficulty talking, and tiring easily. We also learned that palpitations become high risk when combined with dizziness or fainting weakness. Now, let's explore what we have in this session. By the end of this session, participants will be able to understand how to use functional decline as a warning vital sign to upgrade risk status appropriately, know how to select the correct escalation level and appropriate level of response, whether the patient needs emergency care immediately, a same-day medical review, or a routine follow-up appointment. So, let's begin with why should functional decline be treated as a cardiovascular warning sign? In telehealth, functional decline is often one of the clearest signs that cardiovascular reserve is worsening. This matters because telehealth limits direct physical examination. Functional decline, therefore, becomes a practical sign that the patient may no longer be coping physiologically as they normally do. In simple terms, if a patient cannot do what they usually do, that may be the telehealth equivalent of an abnormal vital sign. Examples include reduced walking distance, new fatigue with simple tasks, inability to climb stairs as usual, needing more rest than normal, avoiding movement because of symptoms, and struggling with routine daily activities. Next, we will focus on why symptom trajectory is important in cardiovascular telehealth. Let's explain what symptom trajectory is. Symptom trajectory refers to how a patient's symptoms change over time. In cardiovascular telehealth, trajectory is often more important than one single symptom report. Failure to assess trajectory is a common reason why cardiovascular emergencies are missed in telehealth. For example, mild breathlessness that is worsening is more concerning than stable mild breathlessness. Occasional palpitations that are becoming more frequent carry increasing risk. Chest discomfort that is now happening with less activity is more dangerous than chest discomfort that is unchanged. This is why clinicians must ask, is it improving, stable, or worsening? How has it changed since it started? Is it happening more often? Is it affecting function more than before? Finally, we will examine when cardiovascular telehealth care should be escalated. Escalation should occur when the risk is too high to be safely managed virtually. This may mean emergency referral, same-day in-person review, urgent physical assessment, a higher level of monitoring. The clinician should not wait for full diagnostic certainty before escalating if the risk is increasing. In cardiovascular telehealth, escalation is a safety action, not a failure. Escalation should be based on red flags, symptom progression, functional decline, associated symptoms, uncertainty that cannot be resolved remotely, and limits of telehealth assessment. Note, if deterioration would be dangerous and cannot be safely monitored from a distance, escalation should happen early. In summary, we learned that escalation in cardiovascular telehealth should be based on risk, not certainty. Key triggers include red flags, worsening symptoms, functional decline, associated symptoms, and limits of remote assessment. We also learned that If a patient cannot be safely monitored remotely, care should be escalated early. Increasing palpitations or chest pain with less activity indicate higher risk. Functional decline is a warning sign. And lastly, we explain that if a patient can no longer perform normal daily activities, it may signal deterioration. We have come to the end of this session. Thank you for watching. See you in the next session.